Let's discuss something about back. In our regular OPDs, we see many patients. Almost we can say the maximum number of patients that we see are suffering from some kinds of back pain. Either it is an acute one or it is a chronic one. Ideally, how we differentiate? Normally, somebody is having a back pain suddenly, somebody is lifting up and he is having a back pain suddenly and is not able to move. This is one. These are normally we can say the acute back pain. And somebody fallen down from some height or because of some accident they are having a back pain. This is another cause. These are the normal acute pain causes we can say, and we can say maximum number of causes of this acute pain can be cured with some kind of medicines and physiotherapy, rest, icing. All this can almost we can say the conservative management of back pain will reduce down this kind of pain. But many a times when somebody is having this kind of pain on a regular basis, that is more than 3 to 6 months the pain is there, even after taking lots of medications, doing physiotherapy, icing, everything you have tried and still the pain is persisting, then it becomes very difficult to treat it. First thing is we need to see what are the causes of back pain. Normally people think that if I am having a back pain, the causes probably is a slip disc or it can be a spondylitis. So that is not correct. In youngsters, what we have seen because of facet joint arthropathy, or we can say these are the joint issues. There are many joints in the back. It can be a facet joint, it can be a sacroiliac joint. So these joints can be affected because of some kind of inflammation. So if there is any inflammation, then either it is getting cured through medicines. If not getting a cure through medicines, we have specialized injections, or we can say procedures, which are called facet joint injections or facet joint denervation or sacroiliac joint interventions. So through those interventions, these back pain can be cured. But many a times people complain that we are having a back pain, along with that we have a radiating pain down the leg and you are feeling some kind of numbness in the leg and tingling sensation or pin pricking in the leg. So that may be because you are having a pinched of nerve on the back, which is because of a slip disc, and that we come to know finally from an MRI. Initially, if there is any bony dislocation or spondylolisthesis, then that can be easily diagnosed through an X-ray. But many a times if it is because of some SI joint problem, because of any muscle injury or muscle spasm, or because of slip disc, then it may not be detected through an X-ray. In those cases we go for an MRI. Through the MRI we get to know the exact cause. So first time what we do in a pain clinic is our first aim to get to a diagnosis. That comes through a proper clinical examination of the patient along with an MRI, through which we come to know at the diagnosis. After that we may go for certain diagnostic tests, or we can say those are simple local anesthetic injections around the affected area, which will let us know that whether our diagnosis are okay or not. Now, after getting a proper diagnosis, what we suggest is some kind of neuropathic drugs like pregabalin, gabapentin, amitriptyline. So these are various kinds of drugs which can be given to the patients to get relief from this chronic neuropathic pain. If even after those chronic neuropathic medications, if we are not getting a relief, then what we can do is there are certain procedures which are very commonly known as epidural injections, or you can say transforaminal route interventions, where we approach directly the area which is affected, or we can say because of the slip disc there is some compression over the nerve. We reach that area and infiltrate that area with some amount of local anesthetic along with some anti-inflammatory drugs, which reduce down the inflammation and can reduce down your radiating pain down the leg. And almost like many a patient, within a week you will see dramatic result and the patient will get cured of your sciatica pain or a radiating pain. So if you are suffering from any kind of back pain, mind it, there can be various causes. The diagnosis should be pertaining, and to get to that diagnosis you must visit a pain clinic where you will be getting a proper diagnosis and a proper non-surgical management for this pain. Because earlier what we are doing is we are giving medications, physiotherapy. If it is not getting a relief, you went for a surgery. But there are a lot of complications with those kind of painkillers, and along with that surgical options also. But if we see that there are few non-surgical procedures which can cure your back pain, then if you think that those are the things which can be tried, then pain clinic is the best solution you can come. And the best part is these injections or the procedures are being done under the daycare procedure and under local anesthesia. So any age group patients, like somebody is of 60 years, 70 years, 80 years patient, or it is a youngster, they can come for these procedures. Along with that, if it is we want to repeat it, we can repeat it n number of times. There is no side effect with that, unlike until the surgical procedures, and the cost involved is very less as compared to the surgical one, and the complication rate if you compare with the surgical one are very less. So if you want a non-surgical option for this kind of pain, then you must visit a pain clinic where we properly diagnose, and those who are candidates for this kind of procedures will 100% get a relief out of that.